I'm Kelli Rogers, Associate Editor for Devex, and I'm joined here today by Manuelle Hurwitz, who is the Director of Programs Division for International Planned Parenthood Federation, and by Sarah Shaw, who is the Head of Advocacy for Marie Stopes International. And we're super happy to have you here today, particularly considering the news out today, the new report that shows just how far the global gag rule is reaching. And as we know, it's already had dramatic implications for programming and obviously for the women on the ground who that programming is meant to support. And so I'm really glad to have your take here today on hopefully the systems and the policies and the structures that we need to put in place in order to ensure safe abortion. And so following on that, the new report, Manuelle, that was out today, that looks at 4 different countries and just the scope of the global gag rule and the effect that it's had on programming. I wonder if you could tell me a little bit about what that looks like for your programs on the ground.
So thank you very much, and good afternoon, Kelly. The global gag rule has had some significant implication for our programs at IPPF. The first implication is, of course, quite direct and quite measurable, is around number of projects that have been affected and that had to close down. So, for instance, we've had a total of about 49 projects in 31 countries that have been affected. And to give a little example of what that means, we've had, for instance, in Zambia, 2 programs specifically working on HIV that have had to close, as well as in Ethiopia, 10 clinics working specifically with sex workers and providing an extended and integrated package of sexual reproductive health services that have also been affected and have to scale down their operation, as well as 15 youth clinics. And that is also without counting the significant reduction in commodities that have also been affecting the operations in Ethiopia, but also in other countries. And it's not just in Africa, in sub-Saharan Africa, that we've seen the impact. If closer to this region in Latin America, and for instance, what we've seen is that our region there, covering Latin America and the Caribbean, has experienced a loss of about $4.5 million. And that's really severely affected their programs. And their programs, we are not just talking about abortion program, we're talking about a program on the prevention of Zika, we're talking about HIV programs, we're talking about gender-based violence programs, and they, of course, programs that both in sub-Saharan Africa and in Latin America and in South Asia, which is the third region affected by the global gag rule in IPPF, where people who have been affected were people in the most vulnerable regions, in countries, people who are young, poor, living in rural areas, and migrant populations as well. So that's just to give a little extent of the implication of the global gag rule in measurable terms.
Absolutely.
That's the direct impact. There is a lot as well of the indirect impact of the global gag rule. What we refer to as the chilling effect, that is the fact, and let's just remember what gag stands for. It stands for silence. And what the global gag rule has done is it's really trying and attempting to silence civil society organizations, to silence communities, to silence women. And really, that's what we do need to really make sure that we continue pushing against, and make sure that the voices of the civil societies, the voice of the women, the voice of the communities are not gagged. And I think that's one of the indirect impact, is that chilling effect that is preventing organizations to want to join on the work of what they consider to be possibly directly or indirectly linked to abortion.
Absolutely.
But that's affecting sexual reproductive health and general health care.
Yeah, I was just having that conversation today with someone else actually, and that was her biggest concern, was this chilling effect. And Sarah, I wonder if you could tell me a little bit more about, Manuelle brought up Zika, about HIV, about the far-reaching implications of this beyond abortion.
Well, for Mary Stopes International, because our focus is access to safe abortion, post-abortion care and family planning, for us it's really the loss of the family planning funds that has affected us. I mean, it was 17% of our operating budget in 2017. And the impact of that has been 1.4 million women and girls will lose access to our services by 2020. And we estimate that that's going to contribute to an additional 1.8 million unintended pregnancies, 600,000 unsafe abortions, and 4,500 avoidable maternal deaths.
And even, I'm just sitting here kind of wondering, what about the morale of your staff? Like, how does this affect actual, operations on the ground? Does it impact sort of, really, really deep kind of implications for people's, mental health who are working on these issues, for example?
I think that's an excellent question, because we often do not really recognize or talk about what the impact is on people on the ground. Providers who are doing already work that in very difficult circumstances and very sensitively, as Sarah says, are providing services like abortion, safe abortion care, like providing contraceptive, and also working with very vulnerable populations. And yes, when you do have to close clinics, then unfortunately that also means a loss of job, and it is extremely important to recognize that. At the same time, I think we are very privileged. I think in both our organizations to be working with very, very resilient and strong staff who are extremely committed. And I think that, and this is one maybe of turning ahead a little bit the conversation around the global gag rule, is that it has also generated a huge mobilization. And that huge mobilization is true among the providers, among the staff, who really are more than ever determined to provide the services to women who need them, but also in generating and building a movement of like-minded organizations who really want to do what is right. And we see that in a lot of those regions and those countries where, in actual terms, where we are a small community-based organization working in the Eastern Congo, the global gag rule might affect you, but at the same time, in terms of funding and opportunities, but it also has created opportunities to be joining in a network of like-minded organizations. And then, thanks to the mobilization of other donors, an opportunity to then make sure that services continue to some extent. We won't cover the full extent of what we've lost potentially, because, of course, USAID is a big donor in family planning and reproductive health. But at the same time, I think it's been extremely rewarding to see the other organizations and other donors coming forward and wanting to make sure that some of that gap is filled.
Yeah, absolutely. And I wonder, just considering the new ICRW report that came out that's looking at, what's next, are there, and the sort of regulations and guidelines aren't that clear in terms of the people that I've spoken with. So we're really not sure, it feels like, what happens after this, especially with the expanded global gag rule. Are there thoughts of how that could also impact your work?
I mean, from our perspective, the expanded global gag rule, when it came out in March, we looked across our projects, and we've got 4 projects that are potentially at risk. A couple of them are coming towards the end, and so we're hoping that, maybe by the time the guidance comes out, the project will be ended. The real impact that we're seeing is, because, the size of these projects compared to the hit that we've already taken is quite small. I mean, obviously any hit is a huge hit because it's taking away and diverting attention from the services that need to be delivered. But, it's not so big compared to 2017. But it's what we are concerned about really is, like Manuelle was saying, the chilling effect. It's really going to affect our partnerships on the ground, future partnerships, and also it's essentially censoring other donors. This expansion is essentially saying to other sovereign nations who they can and can't work with, and that's the part that's the bit that's really frightening and really unknown, because we don't know where that's going to take us.
Yeah. I mean, are there ideas, or are you seeing donors speak up already, sort of saying, well, we don't want our funds affected by the guidance issued by the U.S. government, or is there sort of silence while this is being figured out?
Well, the creation of the movement of She Decides has been a clear sign of many donors that they were not ready to be dictated by the U.S. government onto what they could fund, and they really also, it was also a clear sign that they understood the importance of abortion as an essential health care service, and the impact that depriving women of access to safe abortion, what would that create in terms of increase unintended pregnancies and increase unsafe abortion. And they just wanted to make sure that services would continue as much as possible. So I think that reaction has happened, and it's been very positive. I think the extended global gag rule has really created a feeling of uncertainty, and that's, I think, is something we've really been we've had to really work around, particularly a feeling of uncertainty of what could you fund or not fund, who could you work with or not work with in particular, is a really big issue. So a lot of time had to be spent on clarifying so that there is not a risk of over-interpretation. And that is the chilling effect, is this risk of over-interpretation, this feeling that let's not just go there because it's too complicated. We just don't know what that may be. And I think we really need to make sure that's not the case.
And there are also efforts, aside from She Decides, to sort of counteract this. And one example, I think, was this morning, the launch of, I believe it's Safe Access, this online platform to try and get the tools and the education needed about safe abortion out to a wider audience and those on the ground who need it. I'd love to hear a little bit more about that and what your thoughts are on that. And also, I mean, what else... stepping aside from the global gag rule, what else do you want to see happen in terms of policies or structures that would help safe abortion moving into the future?
I mean, the Safe Access project that's a really exciting move to really the abortion community. Over the years, we've generated a huge amount of knowledge and technical expertise, but because abortion is such a stigmatized issue, we've not always been so great about getting it out there and communicating it. And this is a great opportunity to really showcase all the expertise and knowledge that we've built up, and also ensure that it's getting into the hands of the providers and the activists that need this information. And by putting it out there, by being proud of what we've done, this will hopefully contribute to the destigmatization. I mean, one of the big challenges of the global gag is it's already the abortion's already a stigmatized issue. No one wants to talk about it, and we're self-stigmatizing by not talking about it and not owning our achievements. So this is a really great opportunity to get it out there, help normalize, and give those on the ground that are delivering the services, doing the advocacy, give them the tools that they need so they can start owning this in their own context and their own health systems.
And it sounded like a really collaborative effort as well.
Yes,
and again,
a sign of the times that really we all want the same thing, and we also realize that together we can amplify our voice and be much stronger. And I think really what Safe Access does, and we're very proud to be associated with that initiative as well, is that it does allow information and evidence, because I think there has been so much attack on evidence. We are now in a world, particularly we've seen that in the US again, where scientific information is often denigrated. And we need to make sure that through tools like Safe Access, we put back evidence there, and evidence that is generated through implementation of programs, through implementing research, and that we can make available to everyone who really needs to have that information. And So a tool like that, but there are other tools out there that really are going to be very valuable. IPPF has launched a medical abortion commodities database in September last year. And the objective of that database is really to put information on products that are quality assured and searchable, open, public database where you can see what medical abortion commodities are available where. Again, it is about evidence. It is about giving information so that managers, procurers, manufacturers, communities, people, donors, journalists can find the information they need. And therefore, we are, as Sarah said very well, destigmatizing and normalizing the conversation on abortion.
Yeah. Are there other efforts that stand out to you on the ground that kind of play into that destigmatization? Because I think that's such an important piece of this that keeps coming out as part of the global gag rule, but also just writ large around abortion. Are you seeing efforts there? Change there?
Yeah, definitely. I mean, I think from the advocacy perspective, we're seeing the growth of national advocacy networks who are really, civil society are convening to really defend a woman's right to choose and to react against the opposition. You know, we saw recently in Nigeria, there was some opposition activity. And the NGOs just coordinated and organised, and they reclaimed the narrative, and they told their own story. They shaped it in respect of women's rights. We're seeing positive changes in some countries in the policy conversations. You know, we're seeing really healthy conversations around the impact of unsafe abortion and the legal frameworks in countries where previously abortion was hugely stigmatized. I'm thinking, for example, Zimbabwe. There's a really healthy dialogue around, you know, the terrible toll of unsafe abortion in the country. And then I think from the provider's perspective, I mean, we've had great experience with the methodology called Provider Share workshop. Being an abortion provider in a restrictive setting is a long and lonely road. A lot of our providers, often their families don't know what they do, really. People in their church won't know what they do. So they're carrying around a huge burden of not having anybody to talk to or confide in. And Provider Share workshop is a methodology whereby we provide a safe space for providers to come and talk about their hopes and fears around what they're doing, share their experiences, and you know, we've found that that's had a really positive impact in terms of staff retention. It's helped us keep staff. It's reduced burnout. It's made them feel more positive about what they do. Made them feel like they can be very visible activists for the issue. So there are good things happening, and it's what we're seeing in civil society and women reclaiming this agenda, reclaiming their bodies.
That's great to hear.
Yeah.
And I would answer your question from a programmatic perspective.
Okay.
I think that what the global gag rule is really doing, and it is a concerted attack on women, and it is a concerted attack on women's control over their own body. And what's really happening in reality is that women have taken control. There is an increase in self-management of abortion. We've had a lot of sessions during this conference on self-care. WHO is about to launch and release the guidelines on self-care in July. And what is happening is that the technology that is medical abortion has allowed women to really take control and use that technology in order to control their reproductive lives. And that's a progress that we will not stop.
Yeah.
Whatever policies, whatever laws, we will not stop. Of course, there needs to be organizations like Mary Stopes International, like IPPF, that that still need to make sure that there is a supportive environment, so that women are not criminalized for doing something that is their right. And there still is a need to make sure that the method, the technology is safe and accessible and affordable. But at the same time, we will not stop that movement. And that is really the best way of normalizing abortion. And it needs to be accompanied by efforts in order to really open the discussion and make sure that there is a recognition of abortion as an essential health care, so that again we normalize abortion, and that again it is no longer something that needs to be pushed under the carpet.
Absolutely. Are there other gaps on your mind right now, or sort of in your imagination, if you could fix something right now or invent something to kind of to further safe abortion care, or to make, providing it better for, those that work for your organizations on the ground? What would that be, do you think? Or it could be a policy.
I think that, talking again about technology, research is, I think, is still undertaken to improve the technology we currently have. I think a few years ago, no one would ever expect that we would have a combi pack, or i.e. a combination of mifepristone and misoprostol that women could do and self-induce an abortion absolutely safely. Nobody would anticipate that this would also be recognized as a safe method, and that WHO would be now recognizing self-care as an important mechanism of accessing healthcare. So I think technology can always be improved. We can make it. We can make misoprostol more stable, less sensitive to heat and humidity, which means that it's going to be more available in the countries where there are issues around heat and humidity, and where often we do not have access to fridge, or where the commodity cannot be kept in the best conditions. I think that there is the potential also of looking at a product, a commodity, or a pill that could combine both the effect of misoprostol or mifepristone. We can dream of an extended emergency contraception.
You've talked about this before.
The technology still can evolve.
So I think I've got three things. I mean, I think definitely the one-dose medical abortion, because it's the current combi pack. It's complicated, and you may be in a stressed out situation. The last thing you need is complicated guidelines. In the absence of a one-dose MA, I would like to see mifepristone registration worldwide and on all essential drugs lists, so it's prioritised for procurement, which means it is available in the public sector and it's in the system. I'd like to see values clarification and legal literacy around abortion law and regulation be an absolutely mandatory part of pre-service training for all cadres of health providers and lawmakers and law enforcers. Too often we're having to do that as an additional add-on after the event, and it's the NGOs that are having to do it, and the amount that we can reach, I mean, it's a drop in the ocean compared to all the providers out there. And by getting the next generations coming through the system, it will be normalised and acceptable. And then I think the third thing I would like to see is consistent investment in a strong civil society for the advocacy and accountability piece, because we've seen in the US, even when the law is there, do not get complacent. Your work is not done. You're constantly having to hold the duty bearers' feet to the fire, and that's why a really strong civil society and investment in advocacy is absolutely critical to the sustainability.
And on the advocacy side, I would like to really emphasize the importance of not sidelining abortion when we are talking about about reproductive health.
Yeah.
And that's so easy to do. And many organizations and many donors agencies are guilty of doing so. They are claiming the space as large sex reproductive health organization,
Yeah.
a sex reproductive health donor, but the reality is that they are not willing to talk about abortion. They are even less willing to fund abortion services. And until this is going to happen, we cannot really truly believe in sex reproductive health and rights.
Yeah.
I think that's a really good point, Manuelle. I think, when a lot of space is being claimed for family planning, and actually we need to look at that differently and actually think about, this is not about family planning or about abortion. This is about preventing unintended pregnancies and accepting that sometimes women don't want to be pregnant, and that means maybe they need contraception or maybe they need an abortion, but it's part of the same package.
Yeah.
And I'm really hoping that the forthcoming ICPD 25 meetings in Nairobi is an opportunity for us to take what was in Cairo, which was groundbreaking at the time and has got us this far, but to say, actually, we're living in a different world now. We need to reinvent that frame and really talk about unintended pregnancies and women's right to have or to be or not be pregnant.
And popular movement can make that happen.
Yeah.
And they might actually make that happen quicker than us as organization can do. We see what happened in Ireland. We nearly did it in Argentina. And I think we can definitely do it again. And there is that energy and there is that movement. What's happening now in the US might create this again there. We can see it happening really right now. The young generation is mobilizing. And I think that as they are mobilizing for climate change, they will be mobilizing too. If rights that they actually have taken for granted, having been born in a world where they thought these rights were already assured, they will go back in the street and claim those back. So I am optimistic about that. But the other thing I also want to add, and that's really important, is that if you're looking at the global gag rule and what's happening, you do see a pushback in general, because the global gag rule is a result of a pushback from populist government, nationalist government, the macho politics, which our Director General was talking earlier during his plenary session. And we see that in the US and we see that in other countries of the West as well. But in reality, when you look at countries in sub-Saharan Africa, for instance, the revolution is happening. Services are becoming increasingly available without necessarily always as a result of a change of legislation. We need to continue to push for law reform. This is what both organizations are doing. But the reality is that already as it's happening, guidelines are being produced for the provision of services, and we are seeing in some pocket of Africa, and I'm thinking particularly in Francophone Africa, for instance, we are seeing significant advances that are maybe not sometimes enough spoken about.
Absolutely. And going back to the numbers that you both provided at the start of our conversation, which are astonishing, really, the amount of your programming that's being affected by the global gag rule. What will you take back to your organizations from these meetings? Are you expecting perhaps a new partnership, a new agreement, at least a conversation moved forward? What would you like to bring back?
What I think we will bring back is the importance of reaching to actors that we haven't reached to before.
Right.
I think we do need to extend the conversation with organizations working on disability, with organizations that are feminist organizations but may not have seen our organization as natural partners in the past. We do need to also be looking at organizations that work on reproductive health, and are interested and committed to the issue of abortion, but not necessarily do not know how to do it. I am also on the board of the Safe Abortion Action Fund, and the fund works with small local organizations. Just to give you an example, in a recent round, we had 400 applications, and a lot of those applications were from organizations whose primary mission was HIV, was gender, was was disability. And so those countries, those organizations, because of the work they were doing and the communities and the people they were serving, really recognized the importance of adding abortion as part of their services. And we need to have more dialogue with them. And it was great to see them already a lot more present at this conference than they were in the previous conferences.
Great. Yeah. Well, thank you. I don't know if you have something to add, Sarah, quickly before we wrap.
Just quickly, I think for us the main lesson is diversification beyond the health agenda.
Okay.
So making the links with movements like climate change, education, and it's really only when sexual and reproductive health and rights are embedded and mainstream throughout those movements that it will be fully protected and accepted.
Absolutely. Well, thank you both so much, Manuelle and Sarah, for being here, for your insights on the Global Gag Rule. And that is it for us for now from Women Deliver.